All right.
Okay, great. I'll go ahead and so the recording has started now. Thank you all for joining us today for our May monthly webinar. We have, I think, a really important topic this morning on confidentiality and reporting abuse. Olivia St. John is our presenter this morning. She is a licensed counselor at Family and Children's Service, and she holds a master's degree in clinical mental health counseling, and she has a background in school-based therapy. So I think she'll have some important guidelines for us today when we talk about patient and client confidentiality and when it may be appropriate or even mandatory to breach that in cases of suspected abuse. So I will turn the presentation over to Olivia now. She can share her screen and introduce herself to you all.
Awesome. Good morning, everybody. I'm glad to be with you guys this morning. I will figure out how to share my screen here in a second. Unfortunately, in that schooling that I got, nobody gave me any IT classes. So give me just a second. Okay. Looks like it says still working on it, so it's trying to pull up.
I can see your screen now.
Okay, awesome.
I think you're good. Thank you.
Okay, so yes, my name is Olivia, and I have my temporary license right now. I'm in the process of applying for that full license, so hopefully I'll be able to remove that temp here pretty soon. And yeah, I've had been working as a counselor for about 4.5 years now. So I have had, unfortunately, several instances where I've had to breach confidentiality to report abuse and had lots of, some experience with that. So we're going to start off we're gonna kind of just introduce the topics, then we're gonna go into confidentiality pretty briefly. Then the bulk of our time today will be talking about abuse and neglect for both elders and children. Protecting the vulnerable, so what it means to report, what it means, kind of our responsibility, and if we were to kind of see signs that someone is experiencing abuse or neglect. And then the actual reporting part, what is it? What does that look like? What do I do? If you guys have any questions throughout, feel free to let me know. You can pop them up in the chat, and I'll also have a question slide at the end. So feel free to hold out to the end if you want to too. So something that comes up a lot with confidentiality is HIPAA, which is government regulated. You know, it's the Health Insurance Portability and Accountability Act. With confidentiality in particular, there's the privacy rule of HIPAA, which that's the part that kind of encompasses confidentiality. Its goal is to assure that every individual's health information is properly protected, while still allowing the flow of health information, from provider to provider as need be, or to store information properly so that we can, continue to do our jobs and not have to recall in our brains what all happened the previous time. But also to make sure that that information doesn't get anywhere that it needs to not go. So one of the goals is to promote a high quality of healthcare, protect the public's health and well-being, as well as their information. So it kind of tries to strike a balance to permit the important uses of information while protecting the privacy of people who are seeking care and healing. So with that in mind, we're also going to talk about abuse, and I'm going to give you some information on how frequent abuse has been reported. In 2019, there were more than 4 million reports of suspected child abuse or neglect in the US. That's how many were reported. An estimated 656,000 children were shown to be victims of abuse. So not all cases that were reported were substantiated or followed through on, but that 656,000 number are for sure cases that there was found to be abuse or neglect, and that's nationwide. And on top of that, an estimated 1,840 children died due to abuse or neglect in 2019. And then on the flip side, for elder abuse, a 2017 review of 52 studies in 28 countries is a broad, diverse regions of people, estimated that 1 in 6 people aged 60 or older were subjected to some form of abuse. That's about 15%. That's a pretty high number when we think about that. The impact of child and elder abuse and neglect is far greater than its immediate visible effects. These experiences shape development. They have consequences that last years, lifetimes, the rest of a person's life. At times, research shows that physical, psychological, and behavioral consequences of abuse and neglect impact not just the child and the family also, but the community as a whole. It can, increase different kind of circumstances that people are living in, keep people in poverty for longer periods of time, put burdens on healthcare systems, that sort of thing. Abuse and neglect can be devastating for people and their families, not just the people experiencing the abuse, but also the people who love and care for them. And numerous research studies have consistently documented a range of negative health and emotional and psychological consequences and outcomes for those who have experienced maltreatment, especially child maltreatment. The immediate physical effects of abuse can range from something considered minor, such as a bruise or a cut, to severe, such as broken bones, internal bleeding, or even death, like we had mentioned before. The psychological effects, on the other hand, can more lean on the side of isolation, fear, lack of trust, can spiral into long-term mental health consequences like anxiety, depression, low self-esteem, difficulty in relationships, eating disorders, or even suicide attempts. Studies have found also that abused or neglected children to be at least 25% more likely to experience problems in adolescence, including delinquency, teen pregnancy, drug use, low academic achievement, and as adults, children who experienced abuse or neglect have an increased likelihood of criminal behavior, involvement in violent crime, abuse of alcohol, and other drugs and abusive behavior. So I say all of that to kind of outline what the problem is, because it's not just an individual family problem. It's not just a personal issue, but it is a community issue. It's an issue that it affects so far and beyond what that one person is experiencing. And also the experiences of that one person can be rather severe. So, talk a little bit more about confidentiality now. Okay, so what is it? So as a counselor, I am bound to the Code of Ethics with the American Counselors Association. And so I took I took one from their book and kind of pulled a definition from there. Counselors protect the confidential information of prospective and current clients. Counselors disclose information only with appropriate consent or with sound legal or ethical justification. And the ACA Code of Ethics are used amongst a lot of different organizations. They're used in the state as a code of ethics for healthcare provider or for behavioral health providers as well. And so the definition is kind of what I say in or when I'm explaining an informed consent to my clients is what you say in here stays in here. So that includes that personal health information that's covered under HIPAA, but that also includes like physical or mental health or condition of a person. And it includes any individual identifiable health information. That could be demographic data. It can relate to the person's past, present, or future of their health conditions. It can be what kind of health care they're receiving. It can be the past, present, or future payment of that health care, what kind of insurance, or if they don't have insurance, or if all sorts of things as far as payment related. And it really includes anything that could give that person's identity away. So when I'm talking to my clients about confidentiality, I say, the things that you say in here stay in here. And there are limits to that. I want to make sure that they know that there are also limits to that. But before we get to that, I'm curious as to how you guys see have things inside your day-to-day work and practice that protects people's private health information. What kind of things come to mind for you guys? I know for I know for us.
An example, Olivia.
What was that?
I said, yeah, maybe you could give us an example.
Yeah, I know for us, one thing is that we have a HIPAA compliant web platform because we do telehealth visits as well as in the office or in someone's home. And so the way that we, the platform that we use has to be HIPAA compliant. It has to make sure that there's not going to be any like breaches, like if we were to use FaceTime or something like that, that's not considered HIPAA compliant. And as far as documenting goes, like there's places that we put information that, there have to be certain parameters around what kind of information is going in there. And am I just carrying somebody's public health information around the office? Am I, just kind of leaving my door open with my notes up on my computer? Those would be considered potential confidentiality breaches, not necessarily that they are one, but if somebody were to come in and start looking at those notes or to read that who I'm seeing, then that breaches that confidentiality.
I think being careful about what you put in emails, even to colleagues too, if you could touch on that.
Absolutely, yeah. So one thing about communication is hard, especially when we're working with people out in the public, and there's text messages and there's emails and there's all sorts of things. Whenever I am talking to another colleague about a client, or maybe we have a shared client or we're in a group together or something like that, we need to discuss something, keeping things focused on what kind of plans we have, maybe setting up a time for a meeting to talk about a certain thing, sometimes using people's initials rather than their first and or last name can make a huge difference. Also encrypted emails. Encrypted emails can be very, very helpful. And then if I'm emailing or texting or whatever with a client, excuse me, I'm making sure that first, in that first initial time that I'm talking to them, that they know that, hey, here are some limits to the types of communication that we can have, because I want to protect your privacy. And so if we are going to communicate outside of over the phone or in person, then it's probably going to be more about scheduling. Hey, when can we get together? Other than that, let's kind of reserve that for either over the phone, where I can hear your voice and make sure that it's really you, or in a session. Another big thing about confidentiality that I think kind of slips up is when we see people in the community. If we were to, maybe we're off duty, it's a Saturday evening or something, and we go to the movies. And if I see a client out at the movies and I'm like, oh, hey, so-and-so, what's up? How's your day going? That's a potential breach of confidentiality, because that puts that person at risk for, maybe they're at the movies with their parent or spouse or significant other or friend. And then they're like, hey, who's that? Oof, that's a tough position to be in, because then do you say, hey, oh yeah, that's my therapist? That then maybe they don't want other people to know that they're in therapy. Maybe they aren't comfortable saying, hey, yeah, I've gotten help for whatever it is that they're getting help for, and this is my provider for that thing. So that's also a conversation that I like to have with people up front. Say, hey, I'm not trying to be rude if I see you in public, I promise. But I'm probably not going to come talk to you, because I want your information to stay safe. And so me coming to talk to you puts you at risk of then having to disclose information that you might not be comfortable with. If you want to come talk to me, that's totally cool. We'll say, hey, how's it going? What's up? And then we'll each go to our separate movies. Or maybe we're seeing the same movie, who knows? And then we'll be on our way. And that can be an uncomfortable position to be in. That can be an uncomfortable place. But that is one that can put people's confidentiality at risk unnecessarily. So yeah. Do we have any more questions off the top of our heads about confidentiality, before we kind of get to the limits of it, and when we might need to break it?
Well, I have a question. My name is Daniela Escano, and I representing LifeSpring Community Health. And my question is, like, as community health worker, and as a Latino person and serving Latinos, this situation about confidentiality is really hard. Like, and I'm learning, like, because we, as in our culture, we greet, and we can even misread situations, like, why is that this person didn't say hi to me, or so you are helping me to see, like, we need to say this up front, like I said, with our clients. Let explain this, even as a culture, like, we don't have this back in our countries, the HIPAA procedures. So you're just giving me that understanding, like, I have to teach and remind time after time about this situation, and explain, like, hopefully that won't break our relationship with the client. So it's just, I'm making a big note right now in my mind, in my notebook. We have to explain this and remind it many times to our clients. Yeah, no, thank you. Thank you for
Yeah,
this
absolutely. And
teaching.
it can be a really uncomfortable conversation
Yes.
to have. No
Oh,
doubt
yeah.
about it. I think all of the things that we're kind of covering today fall under that uncomfortable conversation
Yes.
category. But it can be really important. And also, a point that you're bringing up too is maintaining a cultural competency about
Yes.
it, and explaining to people, maybe up at front, or up front, or at the beginning, hey, I know that this is weird. I know that this isn't how we work culturally. And at the same time, I do want to have your information protected. And for, you know, especially mental health kind of related things, that those can be culturally, people have so many culturally diverse opinions about that as well. And so then it's kind of giving them that privacy that maybe that they're used to, maybe they're not used to, but that HIPAA says we ought to provide them. So yeah. Okay. So the ACA actually talks a lot more about limits of confidentiality than it does about the actual confidentiality part. And I think that's because it's way easier to say what you say in here stays in here. Blank. Like yeah, I'm just not going to say anything, but that's just not true. And it's just not safe for people a lot of times. So like I said before, we should inform people about what confidentiality is, how we might protect them, how, you know, the awkward situations that may or may not come up at that time, at the outset, but also we should definitely provide them information about the limits of their confidentiality. Times that we really need to disclose their health information, their health care information to other people. So the limits of that would be if we see serious and foreseeable harm in their future. So that can be to them or to someone else. If they are saying that they have plans to harm themselves or harm someone else, then we have to take the correct actions and steps to inform them, to protect them and to keep them safe. And if they're talking about end of life decisions, maybe that it looks like suicide, maybe that looks like ending someone else's life, maybe that looks like ending their life medically. Those are times that we may have to talk to someone else, talk to a supervisor, talk to another professional, talk to the police, that sort of thing. Another consideration for breaking confidentiality is contagious and life-threatening diseases. So that's if someone has something that would be considered contagious and life-threatening and is not going to disclose that to someone else that maybe, you know, maybe they're in a significant relationship with and they're keeping that information to themselves, but that contagious life-threatening disease is putting this other person at risk, then that might be a time when we have to reach out and to break confidentiality. And then also court-ordered disclosures. If the court orders us to appear, to witness, to testify, to share notes, to do whatever it is the court is needing us to do, then that is another reason why we would have to break confidentiality. To the extent that's possible, we want to also inform the clients before confidential information is disclosed, and what information is going to be disclosed. When circumstances require that the disclosure of confidential information, we want to only disclose essential information. So we still want to try to protect these people's privacy as much as we can, within the limits. So maybe I need to share so much information, but maybe they don't need to know this other information over here. And that is what's considered best practices for that. That's another uncomfortable conversation to disclose. Hey, remember the beginning when we talked about confidentiality and times when I might have to, you know, breach that confidentiality where that kind of comes to an end. This is one of those times. And so this is what I'm going to have to disclose. This is what I'm going to have to talk to someone else about. That is, that's an important and difficult conversation to have. So just to recap, the way that I say it is that if you tell me that you are going to harm yourself, you're going to harm someone else, that a child is at risk of harm if the court orders me to do so. And that kind of covers most of them. The contagious, life-threatening disease is what I would consider harm to others, without going directly into that. And then if those diseases come up, then we can have that conversation at that time as well. Because we also want, in that circumstance, we want that person to be the one to disclose to whoever they're close to that they have the disease, that other person might be at risk of having the disease. So now's the time to talk about that. Okay. So with that being said, we're going to go into abuse and neglect. The first thing we're going to do is we are going to talk about who is responsible for reporting abuse. So today we're going to be talking specifically about child and elder abuse, because those are the things that are reportable in the state of Tennessee. And in Tennessee, everyone is a mandated reporter. There are no exceptions to that, but everyone in the state of Tennessee is considered a mandated reporter. It's not like that in every state. Some states, there are certain professionals who are considered mandated reporters, but here, everyone in the state of Tennessee is considered one. So what does that mean? That means that any person with reasonable cause to believe a child is being abused or neglected must, under the law, immediately report to the Tennessee Department of Children or Adult Protective Services, or to local law enforcement. And the reporter can remain anonymous. That is very important to remember. And what happens if I don't report? If I don't report, then that is a violation of the law and is considered a Class A misdemeanor. It carries a sentence of up to 3 months of imprisonment, a fine, or both. On the flip side, those who do report and are considered to be acting in good faith are immune from any civil or criminal charges that could result. So, because people generally, that's not a pleasant experience to have, is to someone report that you are committing abuse or neglect of another individual. And so the reporter is immune from any kind of charges that anybody might want to file into that.
Olivia, can I ask a question?
Sure.
Is everyone a mandated reporter for, is it just for child abuse, or is it child and elder abuse? Can you talk about who all is included under that? Would
Yes.
it include domestic abuse or just?
Right. So I say child and elder abuse because those are considered vulnerable populations. And when I say child and elder abuse, that also includes disabled individuals. Domestic violence is a different kind of thing. So when we think about children and elders, we're thinking about people who require caregivers, people who are requiring more help. They cannot do everything on their own. They're not making decisions for themselves, that sort of thing. When it comes to domestic violence, that is something that we would want to encourage the victim of domestic violence to seek help. There are shelters. There are lots of places. There are several places in the Middle Tennessee area where they can get more information. They can seek, they can either go into a shelter or have other housing or have help to be separated from their abuser, but that is not necessarily considered a mandated reporter thing. Does that make sense? Okay. Now, if there is domestic violence and there is a child in the home, that could be reportable. So sometimes there is a child in the home, sometimes there's not a child in the home. So that one gets a little bit tricky, but yes, domestic violence, because it's considered like that person is if they're an individual who is making their own decisions, nobody's like taking care of them in that way. So in order, like that kind of, it just gets a little wobbly. there are resources for sure, but it's not considered mandated reporting. Okay, so we are going to go into different types of abuse now for children and elder abuse. So the first one is, these are definitions of different kinds of abuse that we could see. The first one is physical abuse, which is considered non-accidental trauma or physical injury of a child or elder, or failure to protect a child or elder from harm. The next one is sexual abuse, when a child is involved in intentional sexual acts that produce sexual arousal and or gratification for the perpetrator, or sexual behaviors and situations in which there is a sexual component. For elder abuse, this wouldn't fit in my nice square, but it's considered non-consensual sexual contact of any kind, coercing an elder to witness sexual behaviors as well. So not just experiencing those, but also having to witness those, and having to witness those would also be considered abuse in a child's situation as well. The next one is neglect, which is failure to provide for a child's physical survival, their needs, failure to provide for their physical survival to their needs to the extent that there is harm or risk of harm to the child's health or safety. And for elders, refusal to or failure by those who are responsible to provide food, shelter, healthcare, or protection for a vulnerable elder. So one thing about the neglect in elder abuse is that people can be considered to self-neglect. So if someone is an older person and they are not, maybe their living conditions are they're like dangerous. They're at risk of falling more often. They're not taking their medication the way that they needed to be. They are putting themselves at risk of certain things. That is considered self-neglect, which is also considered a type of abuse. The next one is psychological. A lot of people also refer to this as verbal abuse, and it's a repeated pattern of caregiver behavior or extreme incidents that convey, to children that they are worthless, flawed, unloved, unwanted, and endangered. They include both abusive acts against a child or a failure to act. And for elders, it's inflicting mental pain, anguish, or distress on an elder person through verbal or nonverbal acts. And then the last one is considered elder abuse, which is financial abuse or exploitation. And it is illegally taking, misusing, or concealing funds, property, or assets of a vulnerable elder. So one thing that's important to remember about the different types of abuse is that they affect people of every race, gender, income level. Demographics they're not really discriminated against when it comes to abuse. Unfortunately, it often takes place in the home, comes from people that the victim knows and trusts, like a parent, relative, babysitter, caregiver, friend of the family, that sort of thing. Oftentimes abusers are ordinary people that are caught in stressful situations, such as young mothers and fathers unprepared for responsibilities of raising a child, overwhelmed single parents with no support system, families placed under a lot of stress by poverty, divorce, sickness, parents with alcohol or drug problems, caregivers with alcohol or drug problems, overworked staff members in like hospital or other caregiving settings. And the recognition of abuse and neglect is based on like a cluster of indicators rather than an observation of one or two clues. So there are four major types of maltreatment, which is kind of what we went through, and then the fifth one being the financial financial exploitation part. So those are the definitions that we've got. Oh, I see somebody got a question, I think. On financial abuse, what if it's not an elder, but maybe someone who is not really capable of dealing with more savvy perpetrators? Could that be reported? So we're gonna get to the what it means to report down at the end, but I'll go ahead and give you guys a little clue into me is that if it seems reportable to you, then you can report it. Like I said before, the law protects people who are reporting against any kind of criminal or civil charges if they're acting in good faith. And so at that point, it's not up to us to disclose it, or it's not up to us to investigate. Is this a crime? Is it not a crime? Is it reportable? Is it not reportable? But to just report and then let those people whose job it is to do that, to do that. On the flip side, elder abuse, I think, gets a little bit tricky because people's cognitions, their abilities differ at different ages. Some people are much older with much more much stronger cognitions than some younger people, and some younger people have much better health or cognitions than some older people. And age isn't really a great indicator of where someone is at physically and mentally. So if you guys are considering, maybe this person is being taken advantage of, then you could talk to them about that, but you could also talk to them about potentially reporting that to, if it's not like the state, then it could be to the police as well. Okay, so possible symptoms or like ways that we would know about physical abuse. So the big ones are broken bones, unexplained bruises, burns, welts, injuries that are in various stages of healing. Like, these things have happened at different times. If a person is unable to explain an injury, or explanations given to them, or explanations given by the victim and the person taking care of them are inconsistent with the injury. So maybe the bruise is much bigger than if a kiddo would have fallen down on the playground or something like that. Oh, and is there an age definition of elder? You know what? I tried to look into that and I didn't find one on the state of Tennessee's website. That's where I tried to pull most of my definitions for the abuse, and I could not find a set age that they have. I consider vulnerable people. And that's kind of where I go back to, if it's iffy to you, then I would probably report it. Okay, so the possible symptoms of physical abuse. The person is unusually frightened of a parent, caregiver, somebody that's intended to be taking care of them, or is afraid to go home. A person reports intentional injury by a parent or caretaker. That one's the most straightforward one for sure. Possible symptoms or signs of sexual abuse. The person has pain or bleeding in any kind of like anal, genital, breast area with redness or swelling. When children display age inappropriate play with toys, self, or others. This one gets a little bit tricky because age appropriate exploration is different than age inappropriate play. So basically, if they know if they're small children and know the ins and outs of intercourse, or if they are talking in a certain way that seems much more adult than what seems typical, then that's something to keep in mind. So in the same way, child has an inappropriate knowledge about sex, that can also look like using a lot of slang terms or vocabulary. I'm going to pay attention to that. If they have bruises around breasts or the genital area, can occur from sexual abuse, as well as unexplained sexually transmitted diseases, broken bones, welts, cuts, sores, or burns. The unexplained sexually transmitted diseases, we are generally going to see that more in adults, but I'm not going to rule that out for kids either. And if the person reports sexual abuse. Possible symptoms of neglect. So I want you guys to know that neglect is the #1 most seen form of abuse in Tennessee, at least, and it might be in the US. I'm not 100% sure on that. And I think that is because it tends to be a little easier to kind of slide under the radar, a little less obvious, right? A little less bruises, less broken bones, less trips to the hospital. But it is just as severe as any other form of abuse. It can be, at least. So the possible symptoms of neglect are the victim show signs of malnutrition. They might beg, steal, or hoard food. The victim has poor hygiene, maybe matted hair, dirty skin, severe body odor. They have unattended physical or medical problems, like persistently. You see there's physical or medical ailments that are not being tended to. If a child states that no one is home to provide care for them, if the child or elder or caretaker abuses drugs or alcohol, that can be a possible symptom of neglect. That does not mean that every caretaker that abuses drugs or alcohol is neglecting the person that they're taking care of, but it is something to certainly pay attention to. And then particularly for elders, having bed sores, unattended medical needs, poor hygiene, unusual weight loss, are all possible signs of neglect as well. Possible signs or symptoms of psychological abuse include parent or caretaker constantly criticizing, threatening, belittling, insulting, rejecting a child or elder with no evidence of love, support, or guidance. So that doesn't mean, criticisms here or there. That's kind of like, man, whenever I hear this person talking to my client, or my client talking to this person, I really am only hearing criticizing, threatening, belittling, that sort of thing. If a child exhibits extremes behavior, I particularly saw that in schools. There would be extreme behaviors, overly aggressive, overly passive. That is something to get curious about, certainly. If a child displays delayed physical, emotional, or intellectual development, unexplained withdrawal from normal activity, sudden change in alertness, and unusual depression may be indicators of emotional abuse. And then behavior such as belittling, threatening, other uses of power and control by spouses or caretakers are indicators of verbal or emotional abuse as well, particularly for those elders. And lastly are signs and symptoms of financial abuse. So these, again, are particularly for elders, a lack of basic necessities that a victim could afford. So if we know that they could afford these things, or if they once were able to afford these things and they no longer are, that's something to pay attention to. If a vulnerable elder or adult voluntarily is giving unusually large gifts of money or large payments for needed care or companionship. When I say voluntarily, that is kind of like, yeah, like I'm giving this, yeah, I want to do that. I'm volunteering to do that. But behind closed doors, there could be some coercion going on that we are unaware of. If a caregiver with control of an elder's money, but fails to provide for the elder's needs. So if this person does not have control of their money and their needs are not getting met, then where is the money going? That money was supposed to be to, pay for rent or to get food, get medication, get all the things that this person needs, and that's not happening. And if a vulnerable senior or adult who signs property, transfers, or over official documents, but clearly does not understand what those documents mean or what they have done. So if this, like a big transactions that this person seems to not really be in tune with, not seem to really know what is going on, then that is also something to pay attention to see kind of what other relationships are going on there. So these are all the possible symptoms or signs, the things that we want to look for to see, oh, is this something I should report? Is this not something I should report? And like I said before, sometimes one is enough. Sometimes one sign is like right there in your face, and it's like, okay, I need to give a call or make a report. And then sometimes it's a couple of littler things. Sometimes it's a combination of things that seem, oh, something seems off here. I think this person might be a victim of some kind of abuse, and then we need to report. So the next kind of thing we're going to go into are the risk factors. So these risk factors do not necessarily mean that because they're in these circumstances that these people are going to be experiencing abuse, but they are saying like, hey, these puts people at higher risk to experience abuse or neglect. So for kiddos, actually across the board, rather than one single risk factor, just like not typically one single sign or symptom, but no single risk factor that typically leads families to mistreat their kids or the people that they're caretaking for. There are generally multiple factors interacting at different levels that lead to abusive or neglectful behavior in families. Factors can be like enduring, they can be chronic, long-term, or they can be kind of like acute, individual kind of things that are stressors to the family or to that person who's in a caretaking role, that can increase the risk of maltreatment. So we're going to take a look at these caregivers with drug or alcohol issues, mental health issues, including depression, caregivers who don't understand children's needs or development, what might be developmentally appropriate to the child, caregivers who were abused or neglected as children themselves, caregivers who are young, single parents, or parents with many children. Can be particularly stressful. Caregivers with low education or income, caregivers experiencing high levels of parenting stress, people who are using spanking and other forms of corporal punishment for discipline, caregivers in the home who are not a biological parent, caregivers with attitudes accepting or justifying violence or aggression. So when it comes to these individual risk factors, especially the spanking one, Tennessee has a definition of what's okay for spanking, and that is with an open hand on a child's bottom, and that's it. That is considered the only acceptable form of spanking. And also, that's important to know, but also important to keep in mind that that also can be misused as well. So just to keep that in mind. And then again, not one single one of these means, hey, this child, this elder is being abused, but just things that kind of put people at a higher risk. For family factors, families that have household members at prison are isolated, family experiencing other types of violence, including relationship violence, families with high conflict and negative communication styles. So if you're seeing families like continuously arguing, can't really get along, they, really just negatively speaking to one another, that can be a risk factor. And then community risk factors. So communities with high rates of violence, communities with high rates of poverty, limited resources, high unemployment rates, easy access to drugs and alcohol, places where neighbors don't really know or look out for one another, where other people aren't super involved in each other's lives, communities with few community activities, especially for young people, soccer teams or different like park activities or t-ball or different kind of activities for people, for kids and families to be involved in. And then families where they're frequently experiencing food insecurity. They don't have the resources that they need to get enough food for everyone in the house. There are additional situations that might place infants at a higher risk. These can be premature infants, infants with any kind of like developmentally challenging thing going on, colicky infants, somebody who's really sick, twins or multiple births, unwanted pregnancy, depression related to pregnancy, or postpartum depression and anxiety. If one parent wanted an abortion, the other one did not, difficult deliveries, separation of mother from infant for reasons of either parent or child health, so not being able to get that attachment started, parent is not understanding what is really needing to take place in the child's life, what really involved to be a parent to an infant, parents who are overly concerned with with maybe gender disappointment, not really, or overly concerned with baby sex, and voice a lot about how they don't know how they will cope with that. Parents who make very little or no preparations for a new baby, these sort of things. And then the last one we've got is risk factors for elder abuse. So current diagnosis of mental illness, that can be for the elder or for the caretaker. Current or past abuse of drugs or alcohol, again, for the elder or for the caretaker. Current physical health problems, past experiences of disruptive behavior, past experiences of traumatic events, high levels of stress, poor or inadequate preparation or training, caregiving, or responsibilities for the person taking care of the elder, inadequate coping skills, exposure to or witnessing abuse as a child, social isolation. Those kinds of things are individual risks for the person either being taken care of or the caretaker. Relational risk factors being like between the person caretaking and the person being taken care of is high financial and emotional independence on that vulnerable elder, past family conflict, and ability to establish and maintain a positive relationships outside of that relationship, lack of social support, and then societal problems, being beyond just that relationship into a bigger one, is staffing problems and lack of qualified staff and staff burnout, stressful working conditions. Something that is important to know is that a lot of elder abuse happens within facilities where they're being taken care of, and a good portion of people who have been, working in nursing homes or other maybe transitional living situations where they're taking care of elders have also admitted to elder abuse. And a lot of that can stem from organizational aspects where the staff is they're understaffed, they're overworked, they don't have the resources that they need as well. So because that they are in some sort of facility or something like that doesn't mean that they have all the things that they need either. Do we have any questions, thoughts, comments about the risk factors as of right now? I know that was a lot that we just kind of went over. Okay. All right. So again, it is the law to report abuse if we suspect it. Abuse, neglect, or exploitation of children and adults. It is the law to exploit it if we see it. You do not have to have proof that abuse has occurred. This is important, and sometimes the reason that many of us refrain from reporting is because we don't have proof that anything happened. But it is vitally important that if you suspect abuse, that you make a referral or make the call. It is important to remember that it's not our job to investigate, but to report. So we don't need to put on our investigation caps and try to figure out all the different things that have happened in this person's life and who all is there and what all is taking place. But if we have a suspicion that something wrong is happening in this person, if this person is being taken advantage of, then that is the job, is to report it. So then, okay, Olivia, I get it. It's the law. I got to do it if I suspect it. So how do I do it? How do I make the report? So Tennessee gives us a couple of different ways. There is the number for the child abuse reporting hotline. There's also the number for the elder abuse reporting hotline. There's also a website, and we can do it online as well, which that can be helpful. And it can be helpful to talk on the phone if you're more of a phone person and want to have that discussion a little bit more. It can be helpful to do it online if you are the kind of person who needs to sit down and think about what you're typing and what you're writing out to be able to collect your thoughts. So it's kind of up to you. Either way, you are going to have the opportunity to do it anonymously if that's what you want to do. You also have the option of identifying yourself. If you've had a conversation with this person beforehand, so we talked about bringing it back to confidentiality. So let's say a kiddo comes into you are working with, and they've got some bruises, and they say they kind of indicate that there might be abuse going on, and then you decide that you're going to talk to that parent about that. And you say, hey, listen, remember at the beginning we talked about the limits of confidentiality, and I'm going to need to disclose this. You have some options there. You can tell them what you're going to be saying to, as far as you know, to the state. You can also have them call and make a report with you. One thing to keep in mind is that DCS, their main goal is to keep families together. One of the biggest fears that I run into is I don't want to report because then my kids are going to get taken away. Sometimes that happens. I'm not going to lie to people and say that's not going to happen to you. But I am going to say that, yes, that could happen. Also, their goal is to keep you guys together. So maybe I'm trying to assess the situation too, to see, yes, I'm going to make a report. Would it be helpful for this family to make a report together? Would it be helpful for me to do it individually? what's kind of going to be the most helpful thing to this family. And kind of getting past that discomfort, that fear that might come up for us for telling them, hey, I'm going to have to do this. Do you want to do it with me? Because a lot of times too, parents will be like, I just don't know what to do. I messed up. And I'm just so stressed. We think about all those risk factors for both children, infants, and adults. Those are really stressful situations. Those are situations where people are really limited in what resources that they have, the support that they have. They're kind of at the end of their rope. And so that can be an opportunity too, to extend, hey, here's some support that we can get you. Do you guys need to get into different programs that are offered? Do I need to connect? They can connect you. Maybe I can connect you. Maybe somebody else, maybe your DCS worker can connect you with different resources in the community to build up that support, to build up those needs that family has, so that they can move on in a healthier way. So, okay, we've figured out the signs of support. We know that this family or this caregiver is stressed. Gonna make the report. Oh gosh, okay. Well, what are they gonna ask me? They're gonna ask you a lot. There's a lot. So again, these are all the questions. I pulled these questions from the state of Tennessee's website. And I want you to know that you are not investigators. You do not have to go find answers to all of these questions before you report. But these are the things that they're going to ask you. If you don't have answers to all of them, that is okay. So you report what you know. And then somebody else will figure out the rest. So the next thing that I have is a couple of scenarios for us to work through and to figure out what kind of red flags there are, maybe what kind of risk factors there are, and what you guys would do about it. Do we have any questions before we get to that? Questions, comments, thoughts? Alrighty. Okay, so scenario one. So I'm going to ask you guys for some feedback here after we read this scenario. So feel free to speak up in the, turn your microphone on, or we can do it in the chat, whatever way you guys want to go about it. It's cool with me. So the first one, we have Alicia. She is 6 months old and has had a severe cough for at least 2 weeks. It has gotten so bad that her whole body seems to seize up when she coughs. She wheezes and seems exhausted. You're very concerned about her health, and you have expressed your concerns to her mom. Mom just keeps saying that it's getting better. The doctor will tell me it's a cold, and there's nothing we can do. It's a waste of time. So what kind of things do we see here? What kind of things kind of stick out to you guys about this scenario?
Seems like it could be a neglect situation.
Okay. Yeah, so it seems like it could be neglect.
I think the mom's response is key, because if she was saying, yeah, I keep taking her to the doctor and we're trying different medication, if she had expressed concern or explained what's happening, but from the response, it seems like she hasn't taken her to the doctor at all. So that would be medical neglect, I think.
Yes, I agree with that. I think, yes, mom's response is pretty key here, because sometimes babies do go to the doctor a lot, and there's questions about like hey, they're still sick. We've been to the doctor 3 times. What's going on? And, but that parent or caregiver is continuing to take them back. They're still under this medical, care. But Alicia, it hasn't been to the doctor, and this has been going on for a little while now. It's, you kind of are seeing that it's getting worse. Mom seems to not be concerned about it. So, yeah. I understand that like we've got community workers here, too, people who are in people's homes or in other parts of the community. What kind of things would you pay attention to about like the client's environment, if anything at all?
Well, in my case, I think you mentioned to focus on what we see in the neighborhood or what kind of neighborhood it is. And yeah, and that has been my experience, just knowing what, if it is in the inner city. So there are other risk factors, I guess, to focus on. Yeah.
Yeah. So to pay attention to maybe if we understand that they live in more of a low poverty level situation, if there's high violence there, there's lack of resources, that sort of thing. Certainly. Also, I was talking to a coworker about this scenario earlier today, and something that came up for her was that she has had experiences with people who are concerned about their kids and are concerned about how to get them taken care of, but they don't have any form of transportation. How am I supposed to get them there? That's something to be aware of too, is kind of what resources does this person have available to them?
We had someone in the chat say that they would be looking at cleanliness in the home, signs for children's medicines out that the mom has been giving.
Yes, I think those are certainly very important too, to keep in consideration.
And lack of health insurance too. So, it could be if the mom had responded that they want to take them to the doctor, but they don't have health insurance or they don't know where to take them. That would be a different situation too, where you could offer that support. That's a different situation than just not taking them to the doctor.
Yeah, absolutely. What steps next? What steps would you guys take next?
You could call and go ahead and report it and let someone look into it further.
Yeah, you could. This is reportable in and of itself. If we're suspecting that Alicia is in a medical neglect situation, then yes, you can absolutely go ahead and report it. You can make a suggestion to the parent. Sure. Yeah, you could make the suggestion to the parent of different ways to, like, if we've identified barriers that this person has to getting her to the doctor. So, I really want to take her to the doctor. I can't. What am I supposed to do? There's so many barriers there. Then we can make suggestions on how we can eliminate those barriers, how we can help to get them to where they need to go, and follow up on that. Yeah, we could also make the suggestion to the parent that maybe if they need to call themselves, they need us to be there to call with them. Okay. All right. So we're going to go on to scenario number 2. Says you are working with a 75-year-old man And you hear his daughter, who's taking care of him, say to him in a nasty tone of voice, "Stop being so stubborn. I need you to give me access to your bank accounts. You're going to die alone unless you start cooperating." As you enter the room, the daughter leaves, and you notice that the patient has tears in his eyes. You ask if everything is okay, and the patient shakes his head yes, but doesn't say anything. After having the appointment, you leave. The exchange between them keeps replaying in your head. What kind of things do you guys notice about this scenario?
It's a very emotional response. Well, it's an emotional statement and an emotional response that you witnessed.
Yes, it is very emotional. Seems emotional on both ends, on the daughter's end and on the client's end. I think I see Martina has her hand up. You can go ahead.
Yes, it looks like she's basically threatening him with the statement, "You're gonna die alone unless you start cooperating." So that was my observation.
Yeah, that does seem a bit like a little bit threatening. Like, who's going to be with you if you don't kind of cooperate with me? Something that I think is interesting about this scenario is that there's a lot of like stereotypes that older people are stubborn. And something that we might hear like that and be like, oh yeah, maybe he does need to just cooperate, right? And at the same time, if she's saying these kinds of things, that seems a little bit coercive to me. And it seems really upsetting to him. Eli, I think you have your hand up too. Go ahead.
Yeah, you look for red flags like the body language, even though many of these elders are under heavy medication, and but still you can read through their body language whether they are being mistreated or not. Just their countenance, and so I think it's very important for one to look at those signs.
Yeah, absolutely. To pay attention to somebody's body language. Body language makes up like 60% of communication, something like that. It's more than half. More than half of our communication comes through body language and tone of voice. Yes. So what kind of things would you guys pay attention to? And what would you do next?
I think the detail about it replaying in your head, that's a good indication that something is not right. If something's not sitting with you right, that's a sign, I think, that you should listen to that intuition, that something is wrong here, in my opinion.
I would say so too. I agree with that. If something is, really ringing for you, and like I said, again, we are not investigators. That's not our job. And so if it's, oh, this really doesn't feel right, this is not sitting right.
I think that if the bank accounts is critical too, because that statement without that one sentence, "I need you to give me access to your bank accounts," is a little more subjective. Like, it's not, she could just be kind of mean. Say, "Stop being so stubborn," in a nasty tone of voice. But the fact that she mentioned access to the bank accounts, I think it's clearly financial abuse at that point and reportable. So
Yeah, yes. And then Kelly said to try to talk with the patient alone and ask questions. Yeah, try to follow up with them. If you guys have an opportunity to be in a one-on-one situation, try to see if they're really okay, right? And yes, I think that this one we have, so there's like the psychological piece a little bit going on and the financial piece a little bit going on. So those are both important to keep in mind. Okay. All right, so on to number 3. You're working with a client who has a teenage son. He's 16 years old, his name's Andy, and his parents were shouting at each other. He'd been grounded for defiant behavior, but was intending to leave the house anyway to meet up with friends. The client tells you a story about her son swearing at her when she asked him to clean up his room first before he left the house. His father blocked his way and as he attempted to leave, saying, "You don't talk to your mother that way, and you'll do as you're told if you want to live in this house." She tells you that Andy responded, "I'd have to be freaking nuts if I wanted to live here," and grabbed the doorknob. She describes that Andy's father shoved him away from the door and Andy hit his head against the bookcase. The father tells you that he never intended to hurt his son this way. So what kind of things come up for you guys about this one? What kind of things are you noticing?
I mean, it definitely looks like a pattern of behavior. I mean, it's pretty clear that regardless of the father, what his intentions are, he chose a form of discipline that is physically putting hands on another person without their consent. So I think that piece at least is clear. And if they're telling you a story, this isn't the first time and it probably won't be the last time. So it's definitely something to try to get them alone, ask a question or two, and assess whether or not, you feel strongly enough about it that it's something that needs to be reported.
Yeah. Yeah, there's definitely a physical aspect here. Even though you didn't see it, right? You didn't see what his head looked like. You didn't see him push him against the bookcase. But you are hearing about it. You are hearing that it happened.
this one seems more gray to me than the other two. Personally.
What seems more gray about it?
I mean, obviously seems like there's better ways that the situation could have been de-escalated, but I also think that this is sounds, at least to me, like a very common dynamic that can happen with teenagers. And
Yeah.
So he's trying to grab the doorknob. The father is trying to keep him there and keep him from leaving and keep him safe. How do you do that? I mean, it's tough. Do you just let a 16-year-old leave on their own? They are still a child. Or do you try to physically keep them in the house? I don't know. I haven't personally been in that situation. It's a tough one, is what I would say. If he is trying to keep him from leaving and then he hits his head against the bookcase, but he didn't intend for him to hit his head against the bookcase. I don't know. It's a tough one for me.
Yeah. I tried to go from most obvious to least obvious. And there's a lot of internal stuff that can happen here too, because he's 16. Apparently he's had some defiant behaviors. What? Okay, so they're his parents. Are they trying to keep him safe? Is this harmful? He's 16. Although he's 16, some people would be like, he's a kid, he's 16. And other people might be like, he's 16, he's basically an adult. The state says he's a kid.
I agree with Mary. I think that this one is more of a tough call, but just, in order to cover yourself, I think it's something that you would probably just need to report and let somebody else look into it and do the investigation and make the decision as to what's really going on there. I have a 16-year-old. I know their malady, and I know they want to do things. They think they are grown and can do things when they want to do them. So, but yes, there was a physical incident here, and so just in order to cover yourself.
Yeah. So while it is trickier, this is still considered a reportable case. And if I would have added one more line about that he would have had a concussion, or that he would have there's bruising left on his head, or any kind of injury to his head from hitting that bookcase, I think it would have been more obvious. But because we're hearing this secondhand, we're hearing it as a story, that's still something to keep in mind. Is that although we're not seeing it firsthand, we still have a responsibility to report there.
I have a question.
Sure.
Yeah, about the Latino community. Have any of you had an experience like having to report a situation, and how is it carried, towards that family, and let's say like they don't have the permission to be in this country, they don't have the documents. So do you have an experience? Can you tell me a little bit about that? I'm curious to know that.
So the more experience that I've had is working with families who have already been reported in like a Latino. One of the schools that I used to work at was in the middle of a Latino community, and so I had several families who they had a DCS report, and then they were referred to counseling because of that DCS report. There were various immigration statuses there, and that is not something that DCS gets involved in. Immigration status is not something that DCS gets involved in. So I'm not sure if that answers your question about.
Yeah, it does.
Okay, it's scary. It's scary for people, and we don't want to make false promises. Like, I'm never going to say DCS is not going to take your kids away. I'm not going to say that because I don't know that. I don't have any control over that. And I'm not going to say, hey, this means that you're in the clear, right? I can say what I do have experience with of, hey, from what I understand, DCS does not get involved with this. They're here to connect you with different places. They're here to keep your family together. Sometimes they can't do that. Most of the time, this is kind of how it goes. So I'm trying to ease that fear as much as I can, but I do not want to give false promises that everything's, yeah, we're going to report some abuse or neglect and things are going to be fine. Does that make sense? That's a really tough one.
Yeah, thank you. I keep learning. Yeah, thanks.
Yes. Oh, okay. Okay. Do we have any other questions? Any other questions for me? Or comments?
I don't want to, if anyone has a question, please go ahead. I don't want to impede on that, but we really appreciate your feedback on these presentations, and we want to make sure that they're, relevant and beneficial. So we have started or developed a quick evaluation survey. So I just dropped the link in the chat. If everyone could go there and just take a minute, it's literally like 3 questions, and fill out the evaluation, that would be really helpful for us. It's anonymous, so let us know what you think. So I'll go ahead and put that in the chat. Another reminder, if you haven't put your name or org in the chat, please do so. I think I got most everyone. So while we're thinking of questions, you guys can go ahead and do the evaluation. That would be great. And I'm going to take back the screen and put up a slide if that's okay.
Yeah, sounds
Olivia.
good.
Okay. I think I just, well, maybe I can share even if you're not. Great. This is just the date of our next webinar. It's next week. It's the next webinar in our TTA series on strengthening proposals. So we'll be talking about abstracts and statement of need. Tariq Smith will present. And that's all I have. So if no one has any questions, then you're free to go. I'll hang out for a little while so that I can keep that link in the chat in case anyone else needs it. But thank you all for coming. And thank you, Olivia, for the presentation. I think it was good, and I'm glad we had some interaction. I think it was beneficial.
Of course. I hope that you guys were able to take at least something from it, and hope you guys have a good rest of your day.
Bye.
Bye.
Thank you. Bye-bye.